You know, when it comes to workplace safety, some rules just have higher stakes than others. And right near the top of that list, you guessed it, respiratory protection. Getting this wrong isn't just about risking a fine, it's about risking your team's health day in and day out. So let's dive in and do a quick compliance check on one of OSHA's most critical standards. Just look at that number for a second. Almost 2,500 violations in a single year. You know, year after year, respiratory protection is one of OSHA's top cited standards. This isn't some obscure hidden rule. It's a fundamental part of so many safety programs. And yet, it's an area where companies just consistently fall short, usually because of a few common and honestly preventable oversights that we're about to cover. And that's the real question, isn't it? Because having a written plan tucked away in a binder just isn't enough. So, over the next few minutes, we're going to walk through the absolute cornerstones of a compliant program. Think of this as a rapid-fire audit for yourself to help you spot any potential gaps before they turn into really big problems. Okay, let's get right into it with our first checkpoint, medical fitness. Here's the deal. Before an employee ever, and I mean ever, puts on a tight-fitting respirator, you have to know if they're physically capable of handling it. Because as OSHA points out, using a respirator puts a real physiological burden on the body. The whole medical evaluation process really boils down to one critical principle: confidentiality. It all kicks off with OSHA's official questionnaire, but here is the golden rule. As the employer, you are absolutely prohibited from looking at an employee's private medical answers. That information is strictly between the employee and the healthcare professional, period. So here's how that process works. First, the employee fills out the form. Then, it goes directly to a physician or another licensed healthcare professional, what OSHA calls a PLHCP. They're the ones who review it, and they might even do a follow-up exam. Only after all that do you, the employer, get a simple, straightforward written recommendation. You don't get any of the why. You just get the final word. It's designed to be a firewall, and it's there to protect your employee's privacy. And listen, this isn't just a one-and-done clearance. The standard actually requires a reevaluation if certain things happen. For example, if an employee tells you they feel dizzy while wearing the mask, boom, that's a trigger. If you're doing a fit test and you notice they're really struggling to breathe, that's another trigger. Or hey, what if the job suddenly requires way heavier physical labor? Well, that increases the burden, and yep, that's a trigger too. All right, moving on to our second checkpoint. So once an employee is medically cleared, we've got to make sure the respirator actually works for them. And for any tight-fitting face piece, it all comes down to one thing: the seal. A bad seal means you have zero protection, which makes the fit test absolutely non-negotiable. Now, OSHA gives you two ways to do this. The first is a qualitative test, the QLFT. It's pretty subjective. We put a hood over the employee's head, we spray in a sweet or a bitter solution, and we just ask, hey, can you taste that? It's a simple pass or fail. The other option is a quantitative test, the QNFT, and this one's objective. It uses a machine to literally measure the exact particles leaking into the mask, giving you a hard number, a fit factor. It's basically precision versus perception. So the big takeaway here is that fit testing is not a one-time thing. It's required before an employee ever uses a respirator on the job, and then you have to do it at least once a year. But, and this is a big but, it also has to be redone anytime something changes. You get a new brand of mask, you got to retest. An employee gains or loses a bunch of weight, you've got to retest. Anything that could break that perfect seal means it's time for another fit test. Okay, on to checkpoint number 3. So you can have a medically cleared employee with a perfectly fitted respirator, but it's all for nothing if they don't know how to actually use it and take care of it properly. And that's where training comes in. OSHA is crystal clear on this. Training is not a one-time thing you do during orientation. The baseline rule is actually pretty simple. Retraining is required annually, but you have to be careful with how you define annually. OSHA is super strict about this. It means within a 12-month period. So a training you did in March of this year needs a follow-up by March of next year, not just sometime later in the calendar year. It's a really common gotcha during inspections. And this really shows you how practical the standard is. That annual requirement is just the bare minimum. If you change the type of respirators you're using, you have to retrain. If you walk by and see an employee constantly wearing their mask wrong, guess what? You have to retrain. It's all about making sure they have the skill and knowledge, not just about checking off a box on a form. And that brings us to our final, and you could argue most critical checkpoint, the documentation. In the world of compliance, there's a good rule of thumb. If you didn't write it down, it never happened. Your paper trail is the only real proof you have that you've done your due diligence. You really need to pay attention to these timelines because they are not all the same. Your written program just has to be kept current. Your fit test records, you only need to keep those until the next one is done. But the medical evaluation records? Oh, you have to keep those for the entire time someone works for you, plus an additional 30 years. That is a massive, massive commitment. This quote just says it all. When an OSHA inspector walks in the door, one of the first things they're going to ask for is the records. Missing medical clearances, fit tests with incomplete details, out-of-date training logs, those are immediate red flags. Flawless documentation is your absolute best defense and the only real proof of a well-run program. So let's just quickly recap the 4 pillars we just covered. Every single program needs confidential medical clearance before use. It needs fit testing that happens annually and whenever things change. It needs training that's ongoing and responsive, and it needs meticulous records to prove it all. These are the absolute non-negotiable fundamentals. And that kind of leaves us with one last thought. You know, it's really easy to have a binder sitting on a shelf with a label that says Respiratory Protection Program. But a stack of paper has never protected anyone. A truly compliant program is a living, breathing system. It's active, it's maintained, it's part of your daily culture. So ask yourself, does your program just exist, or is it truly alive and working?